My father's also a surgeon, and he always describes the work he does as a team collaborative effort with himself, the anesthetist, all the nurses, and surgical staff. And this evening you were talking about the preparations that you do yourself personally for your work, but in terms of working with your surgical team, how do you work with them for the psychological preparation then if something goes wrong in that regard?
That's a great question, and I'm glad you asked that. And I think your dad is spot on about that. I've done a fair number of operations. I've mentioned two that were kind of unusual. One that I got a chance to plan for, one that I didn't get a chance to plan for. But for instance, I did the first lung transplant in the state of Virginia. I also did the first living donor lung transplants, which is where we took a lobe from one man, another lobe from another man, and put them in a little kid. So we had, this is the first time in my life I ever had this possibility where we might have killed 3 people with one operation. And we had to have 4 ORs going, where we had 3 rooms for the patients, 1 room where we were preparing the organs. And the number of people involved, I counted them, was 100. We had them in a room kind of like this, invited everybody there very early that morning. And we had this conversation about, if everybody here does exactly what they're supposed to do, we'll succeed. And if they don't, we won't. And we went around the room and said, what are you going to do? What's your role? What's your preparation for this lobectomy on the, we talked through that team, that room's team, and what they were going to do, the team that was going to be in the room, they're going to prepare the organs and preserve them before we put them in. That took about an hour and a half. And he said to them, you know, everyone in this room matters. Everything they do matters. Everybody is a critically important part of the team. And not just in their preparation or in the discussion in there, but also for what they might see, it might come up during the operation, right? Some of these things are very routine, not like that. I mean, like corn bypass and stuff. So you kind of rocking along with some music, everybody's kind of having a good time, don't know what we did before. We're just kind of, as soon as we said, well, we need to focus for a few minutes and do something. This was different. And we did include in that discussion the idea that we would have a debriefing after that. What could we do different? I had a similar situation just 3 weeks ago when I put in the first ventricular assist device at University of Mississippi, where I just a year ago started working. And one of the reasons they brought me there was to start a program doing that. Same thing, big room, just like this. It was full with the blood bank people, the coordinators, the anesthesiologists, the surgeons, everybody who would be involved, the perfusionists. And we went around the room, once again, same conversation. Everything matters, nothing's neutral. What do you know that we might not know? What have you thought of we might not have thought of? What questions do you have that we might not have asked ourselves or each other? And, but we said, right then and there, we're going to have a time when we're done, when we're going to ask everybody's feedback. Nowadays, it becomes a little easier because we actually do some of this with email. So when we get done, everybody's on this one email list, and all you need to do is hit reply to all. Any thoughts you have, we want to hear them, and we'll collate them and apply them to the next one we're going to do, which is one day after I get back from here. So we'll be ready, I hope, in that time. But the concept of surgery as a team sport and thinking of it that way is one that we've talked about a lot. And it's, I think, crucial to have that mindset.